Mr. Speaker, with your permission, I will make a statement on our continuing fight against coronavirus and how we intend to fulfil our simultaneous objectives, saving lives, protecting the NHS, while keeping our children in school and our economy running, protecting jobs and livelihoods. This morning, the Deputy Chief Medical Officer set out the stark reality of the second wave of this virus. The number of cases has quadrupled in the last 3 weeks. There are now more people in hospital with COVID than when we went into lockdown on March the 23rd, and deaths are already rising. And of course, there are those who say that on that logic, we should go back into a full national lockdown of indefinite duration, closing schools and businesses, telling people again to stay at home, as we did in March, once again shattering our lives and our society. I do not believe that would be the right course. We would not only be depriving our children of their education, we would do such damage to our economy as to erode our long-term ability to fund the NHS and other crucial public services. And on the other side of the argument, there are those who think that the patience of the public is now exhausted, that we should abandon the fight against COVID, stand aside, let nature take her course, and call a halt to these repressions of liberty. And of course, I understand those emotions, I understand the frustration of those who've been chafing under the restrictions, the sacrifices they have made. But if we were to follow that course, Mr. Speaker, and let the virus rip, then the bleak mathematics dictate that we would suffer not only an intolerable death toll from COVID, we would put such a huge strain on our NHS with an uncontrolled second spike that our doctors and nurses would be simply unable to devote themselves to other treatments for cancer, for heart disease, and hundreds more that have already been delayed and that would be delayed again, with serious long-term damage to the health of the nation. And I'm afraid it is no answer to say that we could let the virus take hold among the young and fit while shielding the elderly and vulnerable, because the virus would then spread with such velocity in the general population that there would be no way of stopping it from spreading among the elderly. And even if the virus is less lethal for the under-60s, there will still be many younger people for whom, alas, it remains lethal. So, Mr. Speaker, we don't want to go back to another national lockdown. We can't let the virus rip, and so we've followed since June a balanced approach with the support of many members across the House to keep the R down while keeping schools and the economy going, and controlling the virus by changing our behaviour so as to restrict its spread. That's why we have the rule of 6, and we have restrictions such as a 10 p.m. closing time on our hospitality sector. And, Mr. Speaker, I take no pleasure whatsoever in imposing restrictions on these businesses, many of which have gone to great lengths to reopen as safely as possible, nor do I want to stop people enjoying themselves. But we must act to save lives. And the evidence shows that in changing our behaviour, in restricting transmission between us, our actions are saving lives. Left unchecked, each person with the virus will infect an average of between 2.7 and 3 others. But SAGE assess that the current R nationally is between 1.2 and 1.5. So we're already suppressing that R to well below its natural level, which is why the virus is not spreading as quickly as it did in March. But we need to go further. In recent months, we have worked with local leaders to counter local spikes with targeted restrictions. But this local approach has inevitably produced different sets of rules in different parts of the country that are now complex to understand and to enforce. So, just as we simplified our national rules with the rule of 6, we will now simplify and standardise our local rules by introducing a three-tiered system of local COVID alert levels in England, set at medium, high and very high. The medium alert level will cover most of the country, and will consist of the current national measures. This includes the rule of 6 and the closure of hospitality at 10 p.m. The high alert level reflects the interventions in many local areas at the moment. This primarily aims to reduce household-to-household transmission by preventing all mixing between different households or support bubbles indoors. In these areas, the rule of 6 will continue to apply outdoors, where it is harder for the virus to spread, in public spaces as well as private gardens. Most areas which are already subject to local restrictions will automatically move into the high alert level. As a result of rising infection rates, Nottinghamshire, East and West Cheshire and a small area of High Peak will also move into the high alert level. The very high alert level will apply where transmission rates are rising most rapidly and where the NHS could soon be under unbearable pressure without further restrictions. In these areas, the government will set a baseline of prohibiting social mixing indoors and in private gardens and, I'm sorry to say, closing pubs and bars. We want to create the maximum possible local consensus behind this more severe local action. So in each area, we will work with local government leaders on the additional measures which should be taken. This could lead to further restrictions on the hospitality, leisure, entertainment or personal care sectors. But retail, schools and universities will remain open. As my right honourable friend the Chancellor has set out, the government will expand its unprecedented economic support to assist those affected by these decisions, extending our job support scheme to cover 2/3 of the wages of those in any business that is required to close, and providing those businesses with a cash grant of up to £3,000 a month instead of £1,500 every 3 weeks. We will also provide local authorities across England with around £1 billion of new financial support on top of our £3.6 billion Towns Fund. And for very high areas, we will give further financial support for local test and trace and local enforcement, and assistance from the armed forces, not for enforcement, but rather to support local services, if desired, in the local area. Mr. Speaker, I can report that we've been able to reach agreement with leaders in Merseyside. Local authorities in the Liverpool City region will move into the very high alert level from Wednesday. In addition to the baseline I've outlined, this is as well as pubs and bars. In Merseyside, gyms and leisure centres, betting shops, adult gaming centres and casinos will also close. I'd like to put on record my thanks to Steve Rotherham and his colleagues for their cooperation in very difficult circumstances. Engagement with other leaders in the North West, the North East and Yorkshire and Humber is continuing. I know how difficult this is. They, like us, like everyone in this House, are grappling with very real dilemmas. But we cannot let the NHS fall over when lives are at stake. So let me repeat the offer that we're making to those local authorities. Work with us on these difficult but necessary measures in the areas that are rated very high in return for more support for local test and trace, more funding for local enforcement, the offer of help from the armed services and the job support scheme as announced by the Chancellor. I believe not to act would be unforgivable, so I hope that rapid progress can be made in the coming days. Regulations for all 3 COVID local alert levels are being laid today. today. They will be debated and voted on tomorrow before coming into force on Wednesday. We will also keep these measures under constant review, including a 4-week sunset clause for interventions in very high areas. A postcode search on gov.uk, as well as the NHS COVID-19 app, will show which local alert level applies in each area, and we're also publishing updated guidance to explain what the COVID alert levels mean for those who are clinically extremely vulnerable. And while these levels specifically apply to England, we continue to work closely with the devolved administrations to tackle this virus across the whole United Kingdom. Mr. Speaker, this is not how we want to live our lives, but this is the narrow path we have to tread between the social and economic trauma of a full lockdown and the massive human and indeed economic cost of an uncontained epidemic. With local and regional and national government coming together in a shared responsibility and a shared effort to deliver ever better testing and tracing, ever more efficient enforcement of the rules, and with ever improving therapies, with the mountains of PPE and the ventilators that we have stockpiled, with all the lessons we have learned in the last few months, we are becoming better and better at fighting this virus. And though I must warn the House again that the weeks and months ahead will continue to be difficult and will test the mettle of this country, I have no doubt at all that together we will succeed, and I commend this statement to the House.
I call the Leader of the Opposition, Keir Starmer.
Thank you, Mr. Speaker. Can I thank the Prime Minister for advance sight of his statement and for his telephone call earlier today. Mr. Speaker, we are at a critical moment, a tipping point, to quote the Deputy Chief Medical Officer. We have all seen the clear and alarming trend in infection rates. The virus is now spreading in all areas of the United Kingdom, though much faster in some areas than others. And as the Prime Minister said, and the Deputy Chief Medical Officer said, there are now more patients in hospital with COVID today than when the country went into lockdown on the 23rd of March, and deaths are rising. Nobody should be under any illusion about where this is heading or of the need for decisive action. The question today is whether the restrictions announced by the Prime Minister can bring the country back from the brink, whether they can regain control of the virus and provide the support and confidence that local businesses and communities need. That's how high the stakes now are. So we will consider the package, we will look at the small print of the Prime Minister's statement, we will discuss them with local mayors, councillors and leaders in the areas most affected, and we'll scrutinise the economic package that sits alongside them. But I have to say to the Prime Minister, I'm now deeply sceptical that the government has actually got a plan to get control of this virus, to protect jobs or regain public trust. We've tried to give the Prime Minister the benefit of the doubt, but it increasingly feels like the Prime Minister is several steps behind the curve and running to catch up with a virus that he has lost control of long ago. It was less than 3 weeks ago, 22nd of September, that the Prime Minister came to this House to announce new restrictions. He said then that the measures he was introducing then would, I quote, curb the number of daily infections, that those restrictions were carefully judged to achieve the maximum reduction in the R number. That hasn't happened. Those measures have not worked. We wouldn't be here today if they had. And there's a pattern here. On the 1st of July, the Prime Minister told us of his new whack-a-mole strategy to control local outbreaks. 20 areas have now been in restrictions for over 2 months. 19 have seen their infection rates rise, some by very large amounts. So those measures have not worked either. In May, the Prime Minister boasted of a world-beating track and trace system. He told us it would be a real game-changer in the fight against the virus. We've debated this many times since, but last week the figures were the worst yet. The Prime Minister promised 100% of test results would be turned around in 24 hours, The latest figure, Mr Speaker, for in-person testing is just 24% being turned around in that period. This serial failure, combined with the repeated leaks and briefings to the newspapers in the last few days, have fatally eroded public confidence just when we need it most. So can the Prime Minister tell us, what reassurance can he give us that these measures today will be sufficient to get the virus under control? Will he finally accept that trace and isolate should be handed over to local authorities, as we've been saying for months? Will he accept that the support packages announced by the Chancellor simply won't work for many thousands of people, particularly those on the minimum wage? Mr Speaker, there's huge anger about this in areas under lockdown, and there's a huge gap in the government's plan. And will he confirm that mayors, local leaders, council leaders and others will be fully involved in any future decisions? Finally, I want to say this to the Prime Minister. I know that there will be some on his side who will oppose further restrictions. There will be those that will look at the data and tell him to disregard it, or say the cost of acting now is too high. I want to be clear. The worst thing the Prime Minister can do is not act quickly and decisively enough, or to keep coming back to this House every couple of weeks with a new plan that doesn't work and isn't up to the scale of the task. We need to break that cycle, finally get on top of the virus, rebuild public confidence. I hope the measures announced today will do so, but the House and the country will be deeply sceptical whether they can. Thank you, Mr Speaker.
Prime Minister.
Well, Mr Speaker, we've had a slight change of tack, in my view, from the right honourable gentleman who has hitherto been willing to support the measures that this government is putting in place to restrict the spread of coronavirus, and we now see an equivocation. He wants it both ways. He said he supported the rule of 6, Mr Speaker, and then his side refused to vote for it. He said he's unwilling to support the restrictions we placed on hospitality. He continually runs down NHS tests and trace. What he won't say, Mr Speaker, is what he would do. And what he won't say is exactly how he would propose to get this virus down without those kinds of restrictions. If he supports the Tier 3 measures that Merseyside City Region have rightly put into place today, then he should say so today. He should have the guts to say so to local leaders across the country, that he supports those measures. He encourages them to go into Tier 3. I think it's a stunning silence that we've heard from the right honourable gentleman. We, by contrast, Mr Speaker, are working with those local leaders to put in the measures that will protect their populations, protect the NHS, keep our economy moving and drive the virus down. That is our collective endeavour, and I strongly urge him to work out where he stands, to stop flip-flopping from one side to the next, or rather to go back to his previous position, which was support for restrictive measures where necessary to drive the virus down.